Very nice to meet you. My name is Dr. Mad. So you have an appointment for today? You do? Okay. Can you please verify your first and last name? M-A-R-U-S. Okay. And your date of birth? 01/28/91. Okay, perfect. So I see here that it's your first time. Okay. Can you please tell me what brings you in? Oh, I see. It sounds like quite an accident. I'm just going to write down some of the details that you were telling me. Okay, understand. Well, I'm definitely going to see you today. You do need a cranial nerve exam and maybe some other exams. I'm definitely going to check your nose, your mouth, your ears, your eyes, and your head. I want to make sure that you don't have a concussion or anything like that. Or what we call is subdural hematoma. It's really invisible triggers until something really bad happens to you because of a fall like that. So I really want to make sure that you're okay. Okay. I'm so sorry I'm losing my voice over here, but bear with me. I'm gonna need some medical information from you before we go ahead and do the cranial nerve exam. Do you have any allergies? Okay, so you're allergic to Benadryl, fentanyl, okay, Tylenol, okay, and pollen, okay. And are you taking any medications at the moment? Okay. Okay, I see. And how many milligrams of that are you taking? Okay. How often? Okay. Any other medicine that are you taking? Okay. Oh, you have a list? Sure, let me just go ahead and take a look at it. Okay. Yeah, so that looks very complete. Okay. And do you have any surgeries that I should know of? So you had an appendectomy. Okay. A knee surgery. Okay. And also a tonsillectomy. Okay. Okay. Wonderful. Have you experienced anything like this? Never. Okay. On a scale of 0 to 10, how bad would you rate your pain right now? Okay. And would you say it's all the time? Are you having very frequent headaches since the accident? Okay. And are they localized just in the front, in the back, or all over the head? Okay. Are you experiencing any double vision, blurry vision, any changes in your peripheral vision, or any tingling sensations in your hands, arms, or limbs? No. Okay. That's really good. And do you feel that your strength in your upper body or the lower body is different? No. Any new changes in your facial sensation? You did. So which side, the right or the left? Okay. I'm gonna go ahead and just wash my hands. I'm gonna put some gloves on and then I'll take your vital signs. And what were you doing when you were having the accident? Okay. Was there anybody with you? Okay. Do you remember if you went unconscious? Okay. Just going to put this in your ear. Okay. Just stay still. Okay. So it looks like your temperature is 98.5, which is very normal. And I'm gonna go ahead and put this on your index finger. We're going to measure your oxygenation, and in the meanwhile you can just continue to tell me everything about the accident. Was anybody with you? Yeah. Okay. And did you lose consciousness? You did. Okay. For how many minutes? Okay. Okay. So it looks like your oxygenation is also normal, 98% on room air. I'm going to measure your blood pressure. I'm going to put this on your arm. Good. Good. Okay, so just stay still for me, please. I'm going to put the stethoscope on. Okay, so your blood pressure is elevated, unfortunately. I'm just gonna have to write that down. So your blood pressure was 155/60. So your systolic is a tiny bit elevated, and you don't have any medical history of hypertension, so I'm not sure how to diagnose that, but let's go ahead and continue with the medical exam and we'll know for sure. Your heart rate was also a little bit elevated, so that goes hands in hands with the blood pressure. It was 105. And your respiratory rate, I counted without you even knowing, and it was 18 breaths per minute. Your temperature was normal, 98.6. And your oxygenation was 98% on room air. Perfect. Okay, so let's go ahead and continue. What I'm going to do first is I'm going to explain what the cranial nerve is about. Have you ever had a cranial nerve exam before? No, it's the first time. Okay. Well, so we're testing all 12 cranial nerves, and some of them are clustered into groups. So we're going to do one exercise that would test, let's say, 3 cranial nerves, but mainly we're going to focus on hearing, on smelling, on feeling, and tasting, and also your eyesight. So all the tests that I'm going to do are going to be related to the 5 senses, and if I find anything abnormal, I'm going to write it down and we're going to investigate a little bit more in depth. Does that sound okay? Okay. Do you have any questions for me before we begin? No. Well, first I'm going to start by feeling your face and checking your facial sensation, so we get that out of the way. And now I'm not noticing any droopiness on your face. Your face, when I split it in half, is very symmetric and equal, so that's good. I'm going to ask you to give me a big smile. Okay, and now frown. Good. And I'm gonna need you to puff your cheeks. Keep them puffed for me, please. Okay, and you can relax now. I'm gonna need you to shrug your shoulders. Okay, very good. And now I'm going to press down, and I need you to do that again. Okay, very good. And can you please squeeze my fingers? Good, excellent. Can you please raise your right arm? Good. Raise your left arm. Good. And I'm just going to slowly press down on your hands and arms. Okay, try to resist that. Good. And just keep them back up to the chest level. Good. And I'm going to try to open them. Okay, good. And I'm going to try to close them. Okay, perfect. So it seems to me like your strength is pretty intact. And let's go ahead and start touching your face. Let me know if you feel any kind of tenderness, any pain. Okay. Okay, now I'm going to touch your sinuses. Good. Any pain there? And what about here? Okay. And now I'm going to feel your temples. Any pain? No? What about here? Okay, good. On your eyes. Good. And on your other eye. No pain. Very good. Let's go ahead and check your facial sensation with a different kind of instrument. Okay. Can you please tell me where you feel this? Good. What about this? Okay. And did you feel that equally on both sides? Good. Let's do that again. Can you please tell me where you feel this? Good. What about this? Good. And what about this? Good. What about here? On the forehead. Very good. Now I'm going to do different texture. So this was soft and this one will be sharp. Can you please tell me if it's sharp or dull? Dull. Good. Sharp. Dull. Good. Sharp. Dull. Good. Dull. Good. Sharp. Perfect. Okay. I'm going to inspect your face for any abnormalities, and I'm not noticing anything abnormal with your face. Good. So what I'm going to do now is I'm going to feel your head, your whole head, and tell me if you feel any kind of pain. I'm looking for symmetry, any lumps, any bumps. I know you hurt your head, so I'm also looking for that. Okay. Good. So it seems to me like you're not having any kind of pain, and that's very reassuring. So let's go ahead and do some movements with your head. Can you please touch your chin to your chest? Good. And now look up, all the way up. Are you feeling any pain along the spine when you do that? Good. Now look this way. Good. Look the other way. Good. And now we're going to do rotations. We're going to go to the left, all the way down and up. Good. We're going to do the same thing in the opposite direction. So go ahead, put your chin down and rotate your head. Perfect. Any pain when that happened? No. Okay. Now we're going to check your ears and make sure that the cranial nerve, who's in charge of how your ears are working, is intact. The first test that I'm going to do when checking your ears is the tuning fork test. I'm going to strike it and make a vibration sound. I'm going to put it right here behind your ears. Can you please tell me which position here is louder? So that's position number 1. And that's position number 2. Number 2. Okay, perfect. We're going to do the same thing on the other side. Good. And this is position number 2. So position number 2. Okay. I have one more test. So just relax for me, please. I'm going to put this right here behind your ear on the mastered process. Any pain? No. Okay, tell me when it stops. It stops. Good. Same thing on the other side. Can you please tell me when the sound stops? Good. Okay. And it stopped. Very good. Can you please tell me if you heard it louder on the right or the left, or was it the same? Okay, so it was a little bit louder on the right side. I see. I'm going to take a look inside your ears now. This is called an otoscope. It's going to help me visualize the ear canal. So I'm just going to scooch a little bit more forward. I'm going to ask you to do the same thing. And we're going to take a look inside your ear canal. Okay. So it looks to me like there's some cerebrospinal fluid in the right ear. And that's not a good indication. So I'm suggesting that we do a repeat CT scan and we go from there. Let's go ahead and check your other ear. Okay, so just scooch a little bit forward and just relax. And same thing. So I'm able to visualize the ear canal, and I'm also seeing some cerebrospinal fluid leaking in the left ear. Okay, the fluid seems to be normal color. Okay, and I'm definitely recommending to do that repeat CT. Okay. I'm going to make some sounds, and I need you to tell me how many times you hear this sound, okay? Good. What about now? Good. Let's do that one more time. Just please concentrate. Good. Good. Okay. Now I'm going to make another sound. Can you please tell me if you hear it louder in one ear or the other? Okay, so please close your eyes. Okay. Do you hear one sound louder in one ear or the other? Okay. So what I'm going to do is I'm going to take a sample of the cerebrospinal fluid that you have in both ears, and I'm going to send that to the lab to make sure that it is indeed what I think it is. You know, that fluid that comes from the head, and if it leaks into different passages, it's not good, and that's why probably you're having all those symptoms. So I just think that by doing this, we will make sure that we have the right diagnosis. Okay. Okay, so I'm going to do both in the same time because I feel like it helps with the anxiety, with the pain. Is that okay? Okay. Okay, so just stay still for me, please, while I'm doing this. Shouldn't hurt at all. That's why I'm doing both ears in the same time. Good. Okay. And it feels a lot better, right? Already, yeah. Because while I'm doing this, I'm also taking that fluid out that is enabling you to hear and to feel better. Good. Okay. Let's go ahead and send these two to the lab. Okay, now we're going to focus on your vision, and you said you're not having any blurry vision, any double vision. Good. Okay, so just look right here for me, please. Good. Now I'm going to take a look inside your eyes. Now look right here. Good. Take a look inside your eye. Good. Can you please look right here at my pen? I'm going to approach it. Bring it close to your nose. Good. And I'm going to do that one more time. So please look right here at my pen. I'm going to bring this close to your nose. Very good. Okay, can you please follow the light? I know the light is very bright, and I'm sorry about that. Good, but just try to keep on focusing on the light right here. Good. Can you please tell me when you don't see the light in your field of vision? Good. 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 One more time. Good. Perfect. How many fingers do you see? Good. How many fingers do you see? Perfect. How many fingers do you see? Perfect. Can you please look at my fingers right here? Very good. Look at my fingers right here. Very good. Can you please tell me which fingers are moving, right or left? Good. Good. Perfect. Very good. Very good. Okay. Wonderful. Good. Can you please tell me when you don't see my fingers in your field of vision? So I'm going to wiggle them until you don't see them. And that's when you tell me now. Okay. Good. 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 Okay. It looks to me like your peripheral vision is intact. And I'm not noticing any abnormalities with your eyes so far. I'm going to do an ocular pressure test. Okay. I'm going to do an ocular pressure test, so I'm going to need you to look right here behind me. Try to look straight, okay, like through me. And I'm going to bring this a little bit closer and take a look inside your eye. I want to make sure that I am visualizing the optic disc. Okay, just keep on focusing on my fingers right here. Good. Nothing abnormal there yet. Now look right here for me, please. Okay, very good. Just keep on looking back. And perfect. You can breathe now. Okay, I have here 3 balls. Can you please tell me what color this is? Good. What color is this? Very good. What color is this? Okay, perfect. Can you please follow the red ball? Good. Good. Wonderful. Good. Can you please tell me when you don't see the red ball in your field of vision? Good. 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 Now look at the yellow ball. Okay, try not to be distracted by the red ball. Please tell me when you don't see it. Now, good. Please tell me when you don't see the yellow ball. Good. Again, same thing. Tell me when you don't see it. Good. Tell me when you don't see it. Okay, very good. Okay. Now we're going to check the inside of your mouth. So I'm just gonna ask you to give me a big ah. Give me a big ah. Good. I'm not noticing any abnormalities there. Can you please stick your tongue out? Good. Can you please move it side to side? Good. And now up and down. Perfect. Okay. Wonderful. Okay. And I'm going to give you a few tastes that I need you to identify. So I have here some solutions that have a very specific taste, and any normal person should be able to identify these smells. They're very common. I'm going to put 1 single drop on your tongue. So I'm gonna need you to give me a big ah. Okay. Can you please tell me what that tastes like? Cinnamon. Okay, so see, it's a very common taste. And let's go ahead and try one more. Okay, can you tell me what that tastes like? It tastes like margaritas. Wonderful. Lime margaritas. Good. And I have here one more. Okay, just open your mouth. Good. What does it taste like? Cappuccino. Perfect. And finally, I'm going to check your nose and your smell. Are you having any pain? Okay, so let's just go ahead and just palpate your nose over here. Any pain when I do that? What about here? And no pain there, right? Okay. So I'm just going to put one finger on your right ear. Can you breathe in, breathe out? Good. Same thing on the other side. Breathe in, breathe out. Good. And let's go ahead and look inside your nose. Okay, good. So I'm not noticing any abnormalities there. Okay. It does look to me like there is some cerebrospinal fluid inside your nose as well. So that's not good. Let's go ahead and check on the other side, on the other nostril. Same thing I'm noticing. That's definitely not good. We're gonna have to do the repeat CT scan. It's gonna help a lot to understand everything that is happening with your body right now. Okay, I'm gonna give you a few smells, and can you please identify the smell? Okay, can you please tell me what that smells like? Chocolate, very good. And I have here one more. Can you please tell me what this smells like? Caramel, good. And let's go ahead and try one more. Can you please tell me what that smells like? Pineapple. Your nose buds are intact, and I'm not noticing anything abnormal with your sense of smell, so that's good. And I'm going to write the referral for your CT scan. So I'm gonna write here, repeat due to symptomatic vertigo and cerebrospinal fluid. Okay, and I'm gonna put this stat because we don't want to wait any longer. I'm also going to check on that swab that we did. Okay, any questions that I should be aware of? Okay, well, I'm gonna see you back in a day. Let's give it 24 hours, okay? If you feel any worse, just let me know and give me a call or send me an email, whatever works for you, okay? I definitely want to see you back tomorrow, same time. Okay. And if it gets any worse, just so you know, we have other doctors in this office who can definitely check you, and in case I'm not available. Okay. Thank you so much for coming in. It was a pleasure to meet you. Take care now.